In 2016, I was encouraged to get myself certified in aged care operations under the government, Ministry of Human Resource. And by 2018, I was recognized as the Pakar Industri Negara. And in 2021-22, I started writing the book and compiling my 25 years plus of experience and squeezing the essence of aged care operations into this book entitled Operating Private Aged Healthcare Facilities. Now, which is actually a very similar name to the new Act 802 that says Private Aged Healthcare Facilities and Services. Okay, so this book is written with true essence and over 25 years, and it has 10 chapters that can give you enough guide and information to get you going to learn how to operate and even trigger things that you could move further on and make it better in terms of the training and your own operations. So this is suitable for current operators and even people thinking of operations. This is a book of 20 over years of experience squeezed into an essence over many years, and I've been doing this for more than 25 years now, and I learned from a lot of people. What I have is not new, it's just that something that I put together in a book, and I'm just sharing back what I've learned from others over the years. Now, here, in the first chapter is the introduction. The introduction, there's nothing much there. Of course, I talk about our industry and the challenges. But beginning, chapter 2, it's called Getting Started, Property, Location, Authorities, and Permits. Now, a lot of places, a lot of operators get into trouble, with the authorities, permits, and all things because they do not know the first step to start, and that is to check on the property whether it is allowed to operate, within the limits of that particular council or area. Then the second chapter, we will touch on preparing terms and conditions. So that is a simple guide on how to draft your contract of services. Okay, so it's all there. Now, which you can expand upon. This is not the end of things, but it has all the critical essence, the basics, the key, and the core of aged care. Then the next chapter, chapter 4, we have these things called managing human resources. Forever a problem, manpower, managing human resources. So we teach you how to manage, where to hire, and how to do shift and all those things. So it is a very critical, and to give you a guide. Now, there is no 100% correct way of doing things because each unit is different, but there are at least 85% of what is written here, they are applicable. It doesn't matter when. It's timeless. Then the next chapter is chapter 5, managing daily administration, and operations. So in this part, talk about health, safety, and cleanliness, things that you need to know. What are the core things you need to manage? There are actually 5 things you need to manage, cleanliness, safety, health of the people. So these are things is written here. And we also give you a schedule, a work schedule of 24-hour schedule of what you need to do to run a home. 24 hours, okay? Of course, you can add in more services as well. Now, after that, I'll give the thing is the next chapter is chapter 7 is managing safety and security. Now, this is very important. Safety and security, that's a fundamental. Because safety, there are things like fire safety, they are called security from thefts and all, and of course security and safety of the building, whether the building is safe or not. The floor is non-slip, there's handrails and all. And when we also talk about other safety, is like whether the gates are controlled, visitors provision, those are inside this book as well. Now, we also talk about fire safety, that's for sure. Because fire, in fact, all buildings are designed, or ACTA for care centers, they are in fact a lot of buildings begins with the Fire Act, safety in fire. So that's why you see commercial building they have certain rules and regulations, and residential, they have other rules and regulations. Then the next chapter, chapter 8, okay, managing residents receiving and returning. How to receive them, how to return them. It's very similar to the hotel. Only thing is, one thing is different is this. They are staying long term, and most of them would have medical, physical, or mental challenges. So that is something for you to think about. And chapter 9, it teaches you how to manage incidents. Now there will be incidents. Our business is a business of risk. Okay, we have, for example, let's look at disease risk. So like we have COVID, how do you manage it? Or you have outbreak of influenza, how do you manage it? You have falls, how do you manage it? When people fall down, what happens if they have a heart attack suddenly? What do you do? What are the SOPs or what are the guidelines? How do you manage it? So there are many incidents. Okay, theft, yes, there are people dealing with theft. Are you prepared to report to the police? Or what do you say? Okay, and how do you update families? So these are many, and then of course there are also medication risk. Sometimes the doctor may have changed the medication and the nurses may miss it, but although it doesn't happen often, but it can. But there is also times when they have having too much medication between Chinese and TCM and Western medicine. Too much medication, no good. And finally, managing meals. Okay, food is the number one complaint, which until now, after 25 plus years, is still the ongoing problem for us. Okay, because you're having the same cook cooking for you all the time. So this will be the challenge of all time. So this book is very useful, and of course we are selling it. Of course, selling it at the 40 ringgit. Okay, and it is cheap considering that it is an essence that's squeezed from years of everybody else's experience into a 40-page book. So I hope you can go to iElder to buy. You can always call me and see whether you want it or not. And there are some assessment forms at the back, just to show you what are things you need to do to manage the situation. Of course, this is only a beginning guide. Okay, this is not the end, but it is truly sufficient for 85% of the situation. The other 50% is where the context comes in. What kind of model you run, what's the size of the building, the type of staff you have, the type of clients you decided to have. So with that, okay, my name is Manto, and I put all my 25 years plus into this book. Okay, so hope you get it.